Thank you, Chair, and thank you to all our witnesses for all that you do for our country, and especially in this time of crisis. I believe you have the enormous gratitude and appreciation of all Canadians. My question is around what we have heard about the future. We know that there will be more pandemics, COVID-2, 3, maybe different viruses. So for future preparedness, I wonder if you could comment on your own capacity in terms of medical professionals in the Canadian Armed Forces, and whether you would recommend you need to have more medical professionals as members of your armed forces to help us deal with the future.
Yeah, so the need for more medical professionals in the Canadian Armed Forces has already been identified well before the pandemic. That's not a new issue. And we've been on recruiting modes for many years. The challenge is we're obviously in competition in some ways with the civilian healthcare systems. You know, we're drawing from the same pool of people, and there's as much, if not more, needs in the civilian sector. And I think the pandemic has shown that very well than there is in the armed forces. So that's you know, a fine balance that we need to try to find to bring enough people to the forces, but at the same time having enough of those healthcare professionals. And we're talking here about physicians, nurses, physiotherapists, mental health specialists, different techs in radiology, laboratory, and everything, as well as obviously the specialists in the hospital, the specialist nurses, and all of that. So it's a challenge. It's the right balance that we need to try to find, but we definitely know that we need to grow, and there is definitely a plan for growing our armed forces in order to better equip us for the next missions that the government is going to ask us to do. The other thing that we need to grow is obviously our personal protective equipment stockpile. We've shown that the current stockpile we had was not sufficient, and we're now growing it as we speak. I guess we've started to grow it in the last several months, and we're going to keep growing it over the following months. And we have several procurement processes in place with the support from Public Health Agency of Canada in order to make sure that we have enough for an additional wave or for any other virus or bacteria that could impact us moving forward.